Olmsted County Board of Commissioners meeting for Tuesday, December 14th, 2021, and we will start with the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Full house today.
Good. So we are going to have now a public hearing about the Olmsted County Capital Improvement Plan and authorize the issuance of capital improvement plan bonds. Wilfredo.
Okay. Good morning, Commissioners, Madam Chair. Wilfredo Roman Catala, Olmsted County Chief Financial Officer. I'll just do a brief overview or a summary of our plan. Then I have two actions for you after the hearing. So, again, this is a public hearing for Olmsted County 2022-2026 Capital Improvement Plan. There's a lot of good projects in this plan moving forward over the next 5 years. Obviously, this is a collaborative effort from the departments putting things together. We have shown this document to you multiple times in detail. But in case you have questions, I know I have good friends here, Tony, Ben, Kay, and Matt Miller, they can hopefully answer any questions that you may have. But let's get started with some overview. So we have a total over the next 5 years, a total of $373 million in projects. Of that amount, about $57.2 million is for 2022, and the bulk of $315 over the next 4 years after that. Most of the funding, most of the projects relates to transportation, very critical, keeping our roads and bridges in good shape. So almost 50% of the cost, or about $183 million for transportation. Our solid waste, about 46 million, or 12%. We have facilities grant park of 107 million, or 29%, and other things, equipment, vehicles, and things like that, about 35 million, 10%. So in 2022, we have a number of projects, but I just want to at least mention a few significant projects. 4 million of CASA 44 interchange. That's just the design initiation of the work in 2022. A significant amount of dollars, hopefully, and work can be done in the following 4 years if funding for the states start following through. Then we have another big project starting next year with the judicial space needs, 5.8 million in 2022, and then again you'll see that in future years we have another significant number of dollars related to this particular project that is been on the works for a significant amount of time already. And then we have about 8 million CASA for reconstruction to get that started. For the following 4 years, from 2023 to 2026, I have a very long list of projects here. As you can see, a continuation of Grant Park work for the deferred maintenance, about 2 million. We have a number of projects in the parks in future years, around 2024, 2025 for Oxbow, campground relocation, the Chester Woods Bridge and Trail development, as well as Chester Woods Visitor Center. We have other park improvements within Grant Park of about 6.5 million. And as you can see, there's a continuation of projects with CASA 4, also the construction of CASA 5 for 8.5 million, and so forth. I'm going to just go to the next column to the right. We have a couple that I mentioned before, like the judicial space system almost to the bottom, and the CASA 44. Those two significant projects. The judicial space system space needs 32 million in future years after 2022, and CASA 44 about 37 million in future years as well. I'm just going to leave it at that, just in case you have any specific questions. Um, let's come back to those in a few minutes. And then how do we fund all these projects? So we have a significant amount of these projects will be funded by issuing debt, issuing bonds, about 33% of the funding over those 5 years, 122.8 million. Um, Another significant funding source, this is dedicated to transportation, is sales and wheelage tax, 88.9 million or 24% of the funding source. State and federal funding, about 81.4 million or 22% of the funding. A good chunk of these relates to transportation projects as well. Then we have other funding sources, about 38 million. That could include other local jurisdictions, the city of Rochester, for example. A little bit of levies in there, not too much. And then we have about 41.7 that is unfunded. We still, we have put a number of projects into the equation, hoping that over the next 5 years we have a better idea how can we fund those projects. That's why they're listed, and right now we don't have a specific funding source associated with those. But I think it's good practice to have them in our plan. So in the event those dollars come to fruition, then we can get moving. And then, now is the opportunity for the community to ask questions as well. That's why this is a public hearing. And then once that process have been concluded, our request is for you to adopt the CIP from 2022-2026 and also authorize of up to 20 million in CIP bonds for 2022. And again, normally what we do is when we're ready to issue bonds, we'll come back with you with specific resolution and authorization with more specific amounts. Right now, just give us some idea how to move forward. In case you have questions, specific questions about, Commissioner Brown?
Chair, the 20 million, I assume it would make sense if we're gonna tap that we do it all at once, not in piecemeal, because isn't it more expensive to keep going to the market and paying the issue cost?
Yeah, the issue cost is a percent of the issuance, so no matter what.
So no matter what.
Yeah, they'll get us no matter what, but yeah.
Okay. So, yeah. Got it. All right.
Any other questions? And is there anyone here who'd like to speak to this? Thank you, Wilfredo. Is there anyone online, Lisa?
No,
Once. Okay. Ask two more times. Does anyone like to speak for this public hearing? Is there anyone who'd like to speak for this public hearing?
Make a motion to close the.
Second.
Motion to close the public hearing and seconded. Are there any questions about that? All those in favor say aye.
Aye.
Any opposed? Okay, the public hearing is closed.
Move approval as CIP.
Second.
So we, do we want to do that all at once?
Mm-hmm.
Approve it, the resolution, and authorize the issuance as one motion?
Sure.
Yeah.
Okay. So it's been moved to approve the attached resolution and to authorize the issue of the capital improvement plan bonds. Do I hear a second?
Second. Tim already seconded.
Oh, that's right. He said it right away.
Already did.
All right. Oh, it's my last meeting. Don't.
You've maintained your unblemished record.
Well, I'm glad I didn't disappoint you. Any questions? All those in favor say aye. Any opposed? Motion carries. Thank you, Wilfredo, and all the work you put into that, and everyone else here that put work into that. All right. Then we can move on to the consent agenda. And it's a long one today.
Take a deep breath. Yeah.
Okay. Approve the December 2nd, 2021 County Board meeting minutes. Approve the parks updated master plans. Approve the 2022 Chester Sewer District fees. Eliminate Chester Woods Park vehicle entrance fees. Accept successful transition to adulthood for youth, the STAY grant. Approve 2022 Health, Housing, and Human Services purchase of service agreements. Approve grant application for voting equipment. Accept Public Health Workforce Development Grant. Approve COVID-19 response and vaccine implementation grant amendment. Accept donations for Adopt a Family. Approve revenue reduction to secure ARPA federal funds in 2021. Authorize transit sales and use tax for transportation-related services. Authorize 2022 reserves for general obligation funds. Approve aquatic invasive species funds for 2022. Approve a joint powers agreement to conduct the 2022 residential survey with Polco and 3 other counties in Minnesota. Approve the 2022 countywide scorecard and annual board priorities. Approve the in-county expense allowance. Approve the non-contract compensation plan. Approve salaries for elected county officials. Approve county commissioner's salary and in-county expenses. Approve chairperson's contingency account. Approve 2021 emergency management performance grants. Approve annual liquor license for Shars County Palace. Approve 2022 board and committee meeting calendar. Approve 2022 commissioner committee assignments. Approve reappointments for Olmsted County advisory boards and commissions.
That's all?
That's all.
To approve the consent agenda.
Second.
Second, moved and seconded to approve the consent agenda. Any questions or discussions? Yes, Matt.
A number, eliminate Chester Woods interest. I disagree with that. I think we should keep the fees.
That's D.
So, I approve the rest of it, but if there's nobody else who's gonna second, that's fine. But I disagree eliminating the fees for a couple of reasons. It's a wonderful park. Parks are wonderful, but I think that also helps in security so people don't go down there and just hang around. It's a way to control the atmosphere of the Chester Woods. So if you eliminate the fee, you might have everybody to come down there that shouldn't be down there. So I just don't think we should do that.
So are you moving to take that one out of the,
Yeah, I'll take it out. I'll vote on it. Can we move that on to discussion decision item?
Sure.
Yeah, that's fine.
All right, so we will vote on the consent agenda without item D, and we will move that to the discussion items today.
Thank you.
So, that's approved, so
We got to vote on that.
we have to vote on this. All those in favor of the consent agenda except for item D, say aye.
Aye.
Any opposed? Good, the consent agenda is approved. We'll move down to the discussion and decision items. So the first one is to approve the 2022 state legislative priorities and platform. Jennifer?
Stephanie, shouldn't we take care of the consent agenda thing that Matt pulled off?
We moved it down to the discussion.
That's what we're on right now.
Right, that's what you're on right now. So
You want to do that first?
Dispense
Usually
with that
we
one.
do. It's up to the chair, but we usually.
It's up to the chair.
Up to the chair.
Well, I think we'll just go with Jennifer first.
It's your last meeting.
Thank you.
Thank you.
For authority.
Kabam, baby.
Good morning, and thank you, Madam Chair. I
Give
appreciate
me that
it.
stress ball. I need that stress ball.
Good morning, Madam Chair and members of the board. For the record, I'm Jennifer Burkwa, the Legislative Policy Analyst with Olmsted County, and I'm here today to give a brief preview to the 2022 legislative session and share with you the priorities that the Legislative Planning Group is recommending for your consideration and adoption today. You can go ahead. Okay, so the 22 session is going to convene this year on January 31st. The split legislative dynamics remain. Many of you may know that we're the only split legislature in the country. So the map in the top right corner, that's a diagram from the National Conference of State Legislatures, shows that. Does anybody know why Nebraska is gray?
Unicameral.
Yes.
Unicameral.
They're unicameral, so they won't have a split situation. The House is still has a majority of the DFL, and the leadership there is the same: Speaker Melissa Hortman, Majority Leader Ryan Winkler, and Minority Leader Kurt Daudt. And in the Senate, the Republicans have the majority there. And there have been some changes over the interim in that in the Senate. So the senator from Winona, Jeremy Miller, has been elected majority leader. Majority Leader Gazalka resigned over the summer when he announced his run for governor. And then Melissa Franzen from Hennepin County, Senator Melissa Franzen, is now the minority leader in the Senate. And she took over that role from Susan Kent, Senator Susan Kent, who resigned her position and announced she was not planning to seek re-election. So there's a few changes there. We can go ahead to the next slide, please. As you know, we're coming into the second year of the biennium, so that's a traditional bonding year. And you'll see that many of our priorities reflect bonding type projects and investments. Sort of throwing changing things a little bit potentially is the huge budget surplus that has been forecasted. So that's the November forecast showed a $7.7 billion surplus for this biennium, which is just unprecedented, and I think everybody's really floored about that. Oftentimes there will be a supplemental budget in the second year of the biennium, and it'll be interesting to see this year what they end up doing with that surplus. The tails are also forecasted to have a surplus, so that would be the future biennium 24 and 25. And as of now, that's forecast at $5.8 billion. The $7.7 billion represents about 15% of total biennium spending, just to kind of put that in perspective of the state budget. Some of the drivers that have contributed to this improved forecast include lower national and state unemployment rates, projected growth in GDP. They're seeing and expect more wage and salary income growth, and there's also lower spending, particularly in K-12 education. And then there's also some risks with this forecast. They're still predicting uncertainty regarding the pandemic. There's potential drags on the labor force participation, including childcare, COVID concerns, early retirements. I think a lot of those challenges we're seeing here in our own county. And as you know, the forecast does not account for inflation. On top of the surplus, the state also still has $1.2 billion in unallocated ARPA funds that came to the state earlier this year. And then there's also funding from the Federal Infrastructure Investment and Jobs Act. So we are anticipating about $4.8 billion over the next 5 years to Minnesota, and that's just through the formula funding, highways and bridges, and that's about 30% more than the current funding level. There's also a number of competitive programs that Minnesota and local governments can apply to at the federal level. in the transportation areas and in infrastructure as a whole. I think broadband is included in that, and water infrastructure, rail, transit, anything infrastructure. The Congress is also considering a $1.9 trillion Build Back Better legislation currently, so that could have impacts on our state as well. We also want to be mindful of the upcoming year. It's a big year for redistricting and elections. A lot of folks will be on the ballot this year, and there's policy issues that will be forefront on legislators' minds as well. I think especially in the justice reforms area. All right, we can go ahead to the next part. The draft, we'll talk about the draft Olmsted County legislative priorities. These are the foundation for these priorities is on our mission and goals of Olmsted County. Can move to the next one. And there's more description in your packet. You should have this document, which is what hopefully we'll actually adopt today. But the first three priorities pertain to infrastructure and bonding, and these projects came before you, I believe, in June when we were applying for bonding to the Minnesota Management and Budget. So nothing has changed there. We're seeking funding for the materials recovery facility, construction dollars for the interchange at Passau 44 and Trunk Highway 14, and an exhibition center at Graham Park. Are there any questions on infrastructure or bonding? Okay, we can go to the next slide, please. So in the policy and budget area, once again, we'll be prioritizing the like protecting the viability of resource recovery facilities. That's been a priority for a number of years for Olmsted County. Newer to our priorities this year, but we have been working on these issues in our platform. That would be the local justice initiatives. We're going to focus on increased funding for community supervision. Current statute requires that 50% of the statewide costs for community probation are provided, and it's only at 29% currently. So counties are picking up the tab for the remainder of those costs. So we'd like to increase the state funding. We would like investments in justice reinvestment initiatives. We'd like to work on some statutory changes around data sharing, and this pertains to our co-responder model and how we can be more efficient and be very careful with the data, but be able to share it more easily. And then also investments in mental health, especially in county jails. And then we also will be working on workforce shortages. This will focus on in the health and human services sectors, including residential care, long-term care, public health, and child care settings. And our next priority pertains to capital for emergency shelters. And then we have an increase for county program aid. I don't think we'd be advocating for a huge increase, but to better keep up with historical levels and inflation. That has trailed off a little bit over the years. And then we'll be working on the Family First Prevention Services Act. The state of Minnesota is in compliance now with federal law, but the actual implementation of that has not started yet. And counties just want to make sure we're at the table and preventing any potential unfunded mandates or cost shifts to counties. And then our final priority pertains to our mental health crisis center. Currently, children do not qualify for a Medicaid benefit or for those types of services, and so we'd like to potentially change that, and that would be consistent with what is offered for adults. Mm-hmm. And with that, I'm happy to answer any questions, or if any members from the go ahead.
Madam Chair, a couple of things just to throw a little more onto resource recovery facilities. The public's listening, anybody that cares, there is a concerted effort, which is interesting, by the environmental group Sierra Club, Isaac Walton League. They don't like resource recovery burners. And apparently they'd rather have us put it in the ground. So we're just trying to maintain the designation of renewable resource designation, which gives us an advantage in terms of pricing. So that's the thing that people need to understand. This is crown jewel. It saves incredible amount. It is not dirty, the exhaust, etc. So that's just a plug for the threats that are there, and it comes from an interesting quarter, which are the environmentalists, which I find that really intriguing. Then question, Jennifer, bonding, transportation, with all the money, the surplus, the infrastructure bills, is there discussion you're hearing about, are they still really looking at a robust bonding, incurring debt, or are they going to pay as you go? Is there hearing any discussion along those lines?
Madam Chair and Commissioner Brown, I'm not hearing anything specific, but I would imagine that all of that would be part of the conversation. And I think, sometimes when there's a large amount of money, there ends up being almost more debate, just trying to figure out the best way to invest that. So
I know. Hopefully it doesn't go into programs. The other thing that is worth mentioning is every estimate so far since this thing started, in terms of starting at a deficit and a huge surplus, we now have another February forecast coming out. So the expectations there is going to add to this surplus, probably, because we've missed every mark. So, I mean, it's an interesting problem to have. You're probably right. It will generate far more discussion than it's worth. Put it in the bank, save it, pay as you go for some of the critical projects like 44 and 14. I'm done.
Okay. Any other comments or questions for Jennifer on the platform and the priorities?
if there are no questions, I do just have one quick slide regarding some upcoming timelines. We're here today to adopt the final priorities. We will be meeting with our legislative delegation. Our annual meeting will be on January 14th, and then session begins on January 31st. Thank you, Madam Chair and members of the board.
Thank you.
Madam Chair,
Yes.
I'd just say that the committee Jennifer's worked really well with all of the departments and with the, committee's done several reviews. What she's developed is really compatible with MICA and AMC, and we've been able to have some influence, particularly AMC, by the work that our staff, including Jennifer, did along the way. And I would just call out, I think, the local justice initiatives, the priorities around local justice initiatives and workforce shortages are statewide issues, but I think we've reflected it really well in our own priorities as well. So I just want to take a moment. There was a lot of wordsmithing that went on, and that can be a very frustrating experience for any staff person who's trying to work with the board. I think Jennifer's done a really good job of bringing us information, listening, and working with department heads to come to this place that we have a fairly short but very a lot of depth to this document, thanks to her work.
Yes.
Yep, she's done extraordinarily well. Thank you, Jennifer.
Thank you very much. I appreciate that.
I would move approval.
Second.
Been moved and seconded to approve the 2022 legislative priorities and platform. Are there any questions or discussions? All those in favor say aye.
Aye.
Opposed? Good. Been approved. And secondly, now we will acknowledge the 2022 Olmsted County Housing and Redevelopment Authority property tax levy. Anita. Good morning.
Good morning, Madam Chair, all you commissioners.
And you can
Take your
remove your
mask.
mask if you like.
You would like.
Oh, I I would like.
Okay.
Well, you're easy.
So just for some background, the first resolution is on page 138, item 5B, regarding the HRA levy. So the Olmsted County Board authorized the levy of a special benefits tax by Olmsted County Housing and Rehabilitation Authority. And then last September, the HRA board approved a proposed 2022 property tax levy in the amount of $3,934,341, which is the maximum levy pursuant to Section 469 of the HRA Act. So just want to point out that this levy is collected in all of Olmsted County, except within the city limits of the city of Stewartville, because they have their own HRA. So today I'm asking you to acknowledge the HRA's final 2022 property tax levy in that same amount from September of $3,934,341. Unless there's questions.
Any questions?
Second.
Been moved and seconded to acknowledge the 2022 Olmsted County Housing and Redevelopment Authority property tax levy. Any other questions or discussions at this point? All those in favor say aye.
Aye.
Any opposed? Carries. Thank you.
All right, so the next resolution is on page 140, item 5C, and this resolution is for the adoption of the Olmsted County's payable 2022 property tax levies and the payable 2022 budgets. So there's a lot of numbers on that page. Pursuant to the Minnesota Truth in Taxation Law, once the levy is adopted, I will certify the levy to the county auditor by December 28th. And for Olmsted County, the county auditor is our Director of Property Records and Licensing, Mark Krupski. And then I will also certify the county's truth in taxation compliance to the Department of Revenue by December 28th. So on to the numbers. The second paragraph includes Olmsted County's proposed 2022 levy excluding the libraries, which can be a little confusing. So that's why that amount is $111,467,628, and then that $111 million levy includes appropriations for infrastructure, health and human services, and debt service. And then, do you want me to read those appropriation numbers out loud?
Sure.
Oh, yes?
Okay.
All right.
Infrastructure fund, $6,165,665. Health and human services, $37,825,909. And for debt service, $2,924,012. And then the middle paragraph is Olmsted County's proposed 2022 levy for libraries, which is equal to $1,355,248. And this levy is not collected in Olmsted County cities that have libraries. So that would be Rochester, Stewartville, Chatfield, St. Charles, and Pine Island. And then the last section with numbers listed is the expense budgets of the governmental funds, which are supported by property taxes. And the total governmental funds budget is $246,971,872. And do you want me to read each of those lines off?
Yeah.
Might as well.
Might as well. So for the general fund, it would be $101,794,848. For the infrastructure fund, $38,126,141. Health and Human Services Fund, $89,655,749. For debt service, $9,194,668. For capital projects, $6,845,218, And for the libraries, 1,355,248. And then finally, the waste management enterprise fund budget is equal to 31,414,003, which waste management activities are not levy funded. So, are there any questions?
So Anita, this is at 4.9%, right?
Yes. Yes. It's a 4.9% levy increase over 2021.
I'll make a motion to adopt the final payable 2022 property tax levy budgets.
Second.
Commissioner Podolsky, I'd like to request a roll call vote.
All right. First, are there any, it's been moved and seconded. Are there any questions or discussions at this point? Okay, we'll take a roll call vote. This is, oh. Did somebody ask something? No, okay. To adopt the final payable 2022 property tax levy and payable 2022 budgets. Commissioner Flynn?
No.
Commissioner Cascaden?
Aye.
Commissioner Wright?
Aye.
Commissioner Beer?
Nay.
Commissioner Tyne?
Aye.
And the chair votes aye.
What about Ken? Does Ken
I'm
get to vote
sorry.
today? I mean, I know, but
Yes,
geez,
for teasing me. I'm sorry. Commissioner Brown?
My turn?
Your turn.
Nay.
Okay, so we have 1, 2, 3 nays and 4 ayes, so the motion passes.
Thank you.
Well,
I apologize.
whatever Ken did, he apologized.
Whatever I did, I apologize. Clearly.
okay, and now we will have, is Megan here? Yes, going to have a COVID update. Megan and Mike.
Madam Chair, before public health starts, I just want to tell you that we have scheduled regular updates on COVID for both of the meetings in January as well, given the situation that where we're at right now with COVID. And then we'll reassess at the end of January to determine if we should continue every board meeting with updates or whether we change that cadence. So.
All right, Madam Chair, Commissioners. My name is Mike Mielis. I'm one of the Associate Directors of Public Health, and I'm here to provide an update. Thankfully, Megan is here, our lead epidemiologist and manager of epi surveillance and preparedness. The first thing I'd like to start off with is kind of an overview of the activities that we have and the priorities. So if you could go to slide 1, I'm literally just going to go right down the line here because we have transitioned some of our activities primarily focusing on vaccine planning and implementation. We're actually having clinics in community. It's important to know that we have been coordinating a lot of the planning with the healthcare system and our partners in the system to make sure that public health understands where the needs are. Megan will be able to give you some information on vaccine rates, especially for the age 5 to 11. But an example of that is the healthcare system began immunizing that age group very quickly. And of course, the way the protocols and systems, the healthcare system has kind of an advantage. Public health gets a lot of those protocols a little bit later. That gives us a little more planning time. But our healthcare system really got out in front of that, and we, especially with the parents that wanted to have their children immunized quickly, that rate jumped quickly. So that allows us to work with the planning teams and our healthcare partners to identify where those populations, the organizations, where we can serve them. And I'll actually wrap up our presentation with a listing of those vaccine clinics. The second item is consultation and guidance. And as you probably experienced throughout the last 2 years, guidance regarding COVID has modified, it's changed, it's morphed as we've understood the COVID virus throughout the last 2 years. And we continue to provide that consultation. And when there's changes, we share that with our partners, certainly schools, businesses, and communities. Epidemiology and surveillance continues to be very important with our work, so we have our head up and our eyes open. Epi, certainly the population, the data on the disease, and then surveillance, turning that data into information. And unfortunately, with the rise in the cases for probably the last month, our health system has definitely been burdened by that. Megan has more information around that, but our health system locally continues to be stressed. Healthcare workers and public health workers have been stressed, but recently we've seen that become more severe. And we're doing all we can to make sure that those staff are supported. And certainly in the health system, they're seeing a lot of challenges there. Coordination with MDH continues to be important. Obviously, early on in the pandemic, coordination of vaccine was a big issue. The flow of vaccine is very good right now. If providers need it, they can get it. And along with that, the protocols that came with it, as each population was added, there was specific changes. And certainly with the 5 to 11 group, there are specific vaccines and protocols. And then certainly working with MDH on guidance all the way through the pandemic, but a lot of that guidance still remains. And while the executive orders no longer pertain, the guidance is still very important, and recommendations still exist to wear face covering, social distance, avoid large crowds, that kind of thing. But it's important to know that vaccine really is our best tool right now. I will have a couple of thoughts as we wrap up and we look at the vaccine clinics that we have scheduled as we go into the holiday season. And then finally, or not finally, joint information has been super important, of course, and we coordinate with our partners in the healthcare system. We have a joint information center. We meet with them very regularly, and certainly in response to media requests for interviews, but also being proactive in getting out information or changes. And a lot of information, as an example, will be what Megan will be presenting shortly. And then one thing that's really important, I think, that often is not easy to see, but leveraging a lot of the resources we have throughout the county, and not just in the public health department, but within our HHH division and through other departments. One example I would bring up is, which was very important during the peak of the illnesses, is essential services. And we still continue to need that from time to time when individuals in the community need quarantine or isolation. And so we lean on our HHH partners and staff who are skilled in that, just as one example of continuing to leverage subject matter experts in our department, in our division. Yes.
Mr. Nice, what is IC structure?
Well, it's our incident command structure.
Okay, thank you.
So we remain mobilized. I guess you probably should have started with that, but we've had been mobilized using the incident command system, having an incident commander, command staff, all the way down through leads for planning teams or whatever. So we maintain that incident command structure right now. In the coming months, hopefully we see COVID wane, and we may look at deactivating some of that structure. But right now we remain mobilized.
And is that only public health staff that are in that incident?
Right now it is.
Command structure?
Right now it is. We, though, as an example to your question, so yes, it's public health staff that are in specific incident command positions, but that allows us then to be more organized and communicate better. And when we need to leverage those subject matter experts or assets or resources throughout the division and even county at times, it's a little bit easier. It's coordination.
Thank you.
Yeah, thank you for the question. And then certainly we'll have some time after Megan is done here for questions. Speak. Thank you.
Just a comment, the public should feel very confident that even in light of the previous director seeking new opportunities, which we hardly support, that we've not lost a step relative to our communication, coverage, and response to this continuing pandemic. That's it.
Thank you,
I think it's
Commissioner
been easy for people to assume that the spokesman is the key to the organizational structure, and I don't think that that's really been the case. Is never the case. You aren't very visible to the general public, and so people associate the director as the lead for all aspects of the relationship. And the incident commands, if we don't know what an IC is, the general public isn't going to know, and the general public isn't going to know that you have regular communications with with Mayo, with Olmsted Medical Center, with social services. So I think having that visibility is reassuring to the broader public that we're taking care of it, but it hasn't been very visible when we just look at data, and that's tends to be what we've looked at as data and advice, and not necessarily what's behind that's doing the public health protection and investigation, and vaccine clinics and those kinds of things. It's kind of that's always the dilemma for public health. When it's working really well, it's not very visible.
Yeah, Madam Chair and Commissioner Cascaden, you raise an important point. And within the incident command structure, an important dynamic there is a role, the public information officer, who's typically a coordinator. They can be speaking and engage with the media or be a spokesperson, but what we've found is that, yes, it's helpful to have a familiar face, but it's also really important to recognize that the spokesperson for whatever issue you're going to be dealing with be informed and knowledgeable so that they can address issues that may not be in the canned expected talking points or whatever. So we've always felt within our department that we have some core key spokespersons that we've always had, specific managers or whatever, and we look to continue doing that and making sure that when we are providing information through spokespersons, that it's putting that person in front of the public that has the skill and expertise. So I think that's a really important point of us moving forward. So thank you.
Good morning. All right, so I am going to do the data portion, but we can talk a little bit too about some of our key community partners. And I think the one thing too, when we look at data, it's getting it in front of the right people to help make decisions. So for example, like yesterday, meeting with our joint information team of getting the information out, seeing where we're at, and then being able to form key messaging, such as the importance of vaccine that will be carried through. I always think it's always good for us to kind of start at that national level, state level, and then we can get a little bit into talking about what we're seeing locally here. So here are two graphics from the New York Times, and this graphic also helps provide a couple of other key things of total counts. So unfortunately, yesterday or today, the United States is predicted to hit 800,000 deaths from COVID since the pandemic began. With over 500,000 of those deaths happening in 2021. There's with reaching that milestone as well, there's the assumption that 1 in 100 of our 65 plus residents of the United States have passed away from COVID. So that it's just, to kind of drill that down a little bit. In the United States overall, we're kind of seeing this bouncing effect. We're seeing still in the Mountain West high case rates, and we're still seeing like in Michigan and New Hampshire are kind of leading the way with current case counts. In Minnesota, we're kind of experiencing here in Olmsted County, just like what Minnesota is kind of this bouncing, what I'm going to be calling bouncing down, that we'll probably see a couple of bouncing up in case counts, but then hopefully we'll continue to kind of do this little bounce down and then get that to the beginning of 2022. Here in Minnesota too, we will hit some key some milestones as well, of probably by next week or the next week and a half, reaching over 1 million cases of COVID in Minnesota, and then either probably today we will hit 10,000 deaths in Minnesota as well. So it's always kind of a somber moment when we look at and we think through that. Here is looking at our county cases, and so you can see I highlighted our 3 top case weeks. So when I came and talked to you all before, we were right around that 900 or that 926. And then we bounced down right after things or right during Thanksgiving, and then we bounced up just like what we were expecting with that Thanksgiving surge. Some late breaking news for you. We just got our totals for the past week, and we'll actually have gone down to around 554 cases for this previous week. So again, we're gonna so just like what we saw in 2020, around this time, we'll see a peak, we'll see a bounce up, and then we'll go down, we'll bounce up, and then hopefully what we'll see is a kind of a decrease of cases up for the next 2 weeks, and then we'll probably see a little bit of an increase right around the first of the year, but then hopefully we'll continue that like bounce down that we saw in 2020. The other key, so we're monitoring that very closely because that is also the case, or we're seeing very similar trends for our hospitalizations as well. So this is looking at a different way of looking at our hospitalizations. Typically, I believe we show just that over time. I thought this was important to call out because we actually had our highest admissions rate, number of cases per week this past week. We continue to see, and I think our healthcare partners, you saw the article or op-ed that was signed of our healthcare partners are feeling that strain. The key things here with our hospitalizations, we are seeing more of the increase in our hospitalizations more in our non-ICU. Our ICU cases are remaining around 6 or 7 per week, which is still too high, but at least we're not seeing that increase that we're seeing with our non-ICU. So key trends, according to the CDC, we are still in high community transmission, and we have been there since late July. And then I just have listed some what we'll call undesired milestones, just like we've been seeing with the United States and with Minnesota. We saw our highest case counts for the entire pandemic in our last few weeks in 2021. We saw our highest percent positivity for the entire pandemic. I do believe part of that is due to the lower testing numbers that happened over the Thanksgiving holiday, and I think we are rebounding. And we have seen that according to the CDC, they had us around 15% a week and a half ago, and that's dropped to like 10.7 or 0.17%. Here in Olmsted County, we have reached over 1,000 hospitalized cases for the entire pandemic, and we've reached over 200 cases admitted to the ICU. And all of that happened basically last week for us. I am going to spend just a little bit of time talking about variants, and I'll give you a little bit of a status update about Omicron. But spoiler, there's not much there more to tell you than what we've talked about last time. I think this graph just helps us, and this is produced on a weekly basis in MDH's weekly COVID report. The key takeaway here is Delta is still extremely prevalent. We're still looking at around 99% of our cases, not only in Olmsted County, but in Minnesota, are Delta. With Omicron, we have had our second case reported, a confirmed Omicron case over the weekend, and that was in the Mankato area. So just some key points. So these are talking points that Chris Ayersman gave local public health at our last weekly meeting. So again, I think it's also important to know we are still in the very, very early stages. There's new studies coming out every day talking about this. So I think that third bullet is going to be super important, that we really need to see these real world conditions, and even more in a real world sense of what Omicron looks like here in the United States versus comparing us to what's happening in South Africa or even the UK. And I say that because of boosters are going to hopefully change the trajectory of Omicron here, because we have started our boostering much faster than those other countries. So some early predictions that we are seeing: enhanced transmissibility, increased infectivity, but hopefully milder symptoms. I think the biggest thing here is the second bullet too. We're not changing our mitigation strategies at all. The biggest thing right now is for anyone who hasn't, is to be vaccinated. We've seen some of the early research has shown that boosters are going to be our key defense against Omicron. And so, like I said, we're still kind of waiting to see what these real world or conditions look like. Hopefully, by the end of the year, we'll have a better grasp on what this could look like for here in the United States and here in Minnesota. And again, just it's always important to call out, variants will continue to emerge, and we will always be continuing to monitor that situation. All right, so let's talk about vaccine. So I don't know if anyone can think back to December 14th, 2020, but it was kind of a big day for our COVID response efforts here in Minnesota. It was the day that vaccine rollout started. So that's even just to think back a year ago for where of getting that and where we have come. So here's looking at Olmsted County data specifically. You can see that our total populations around 79% have received at least one dose, with 74% completing their series. You can also see on the bottom is looking at our different age groups. So this is taken from yesterday, and looking at today's numbers that will get posted, we'll probably be at 41% for our 5 to 11-year-olds. Another key milestone we hit last week with vaccine is that 80% of our 12 to 15-year-olds have received at least one dose, and we're around 40% of our eligible population has received an additional dose. Another key thing that happened last week too in the vaccine world is 16 and 17-year-olds received approval to get boosters. And with that, I'll just take a moment to ask if there's any questions on the data, or I'll turn it over to Mike to kind of wrap up and really talk about our current clinic efforts.
No questions.
How do you decide where to have the vaccine clinics?
I can let Mike take one of us can answer that. Well, we have made an effort to work with our school districts and where they've expressed interest. We have reached out to all of them, and that's really where we have landed on. Then we've also have had our manufacturing facilities have reached out and asked for support, and if we're able to do that, that's how we are. And this again goes back to that collaboration that I think Mike will touch on.
Are we particularly concerned about any cultural enclave not being vaccinated?
So
where's the vaccine hesitancy in our community?
Yeah, I mean, we still continue to see vaccine hesitancy, and we have been working, and we've actually reactivated someone to work specifically on outreach with key community partners, such as the Rochester Healthy Communities Partnership, Diversity Council, and things like that, to really make sure that outreach is just not focused on one particular group, and then working with those key cultural brokers to ensure vaccine.
Yeah, I would just add, and Megan did a good job there. I think the point is using the data in Appian to see vaccine rates or uptake where the populations are using or going to clinics. If we start to see a slowdown of that or hesitancy, why is that? And to work with partners. We just wanted to show this to the board so that you have an idea about where we're going. The primary push that really came on strong when the 5 to 11-year-olds were approved really came through the private sector. We knew that was going to happen in a vaccine planning team coordinating and working with our healthcare partners. They understood generally where that demand was going to come from. So they were prepared. We probably are seeing a little bit of a slowdown, but we're going to continue to be making vaccine available. And 60 events throughout the month of December, I would guess there's going to be additional events added to this. It's a good example of a variety of places that we're providing vaccine, obviously not in a clinic setting, although in our public health office building, we have that clinic setting where we're providing vaccine for people. One of the goals that we're trying to do is when we have a setting where we're providing vaccine is to make it available and convenient for parents, certainly for the youth. But you can see also on there our manufacturing locations and specific, I guess, groups or community groups that we actually they reached out to us. So that's one way that we were able to respond and provide the vaccine. Any questions about that?
I have a question and a comment. This is very impressive, all these clinics that you have set up. I see that sometimes it's a Pfizer and sometimes it's a Moderna. Do you have any way of knowing whether people are mixing? Because there was that's also one of the things that's changed. At first they said you should stick with the one you had for the first two. And then they said, well, maybe it makes a difference if you take a booster in the other one.
Well, I think what I can speak on to your question, Madam Chair, is the way we are approaching these vaccine clinics is to make it as straightforward and uncomplicated as possible for the staff who are actually giving the vaccines. And our goal is efficiency of throughput. So when we have a clinic up there, individual listed one, we're typically focusing on one type of vaccine, one type of population. We've chosen to not mix and match, making it available. I would think that at times when we have a clinic in the building, we may have some flexibility, but typically when we have a specific population, we have a specific effort to try to get them registered ahead of time so that we can be efficient about how they go through. There's an important dynamic with this age 5 to 11. Really, we experienced it with the older teenage years population, but the medical private providers clinical setting has an advantage over kind of a more of a larger, I wouldn't say a massive vaccine event, but a larger throughput. Children 5 to 11, certainly they have parent or guardian with them. They're less likely to be looking forward to having a vaccination. And so we want to make sure we create an environment and maintain an environment that is efficient and effective. And so we've been very careful about how we set these up. Any questions about the vaccine? I have one more thought.
I had one more question, different. Olmsted's doing very well in terms of vaccination rates, obviously. The state seems to have stagnated. Is that kind of true? That they haven't moved very much?
That's a good question, Commissioner Brown. I don't know the exact where the state rates of vaccine, if they're tapering off or not. But what I have been throughout the pandemic and throughout the phase of where we've been providing vaccine, Olmsted County has been leading. Obviously, we have some really large proactive health systems here that help quite a bit. But even in populations like the 5 to 11 was very quickly, we were out in front. In fact, I think there's like one county, you've probably heard this before, that has been ahead of us, population of 5,000 people. We just can't seem to get in the number one spot and stay there. But we're very happy with how quickly the vaccine uptake is going.
Okay.
So to your question, yes. One thing I'd like to just wrap up finally with the update here is we talk a lot about vaccine, how that is an important thing that everyone in the public can do and make a decision about to protect themselves, reduce the risk of them being, transmitting the virus. It's not completely 100%, but it's a great way. It's one of our best ways to suppress transmission and certainly the severe illness and hospitalizations and even preventing death, our best tool. But I also want to kind of wrap up this update with the importance as we head into the holiday season. Great news that our cases are down in that 500 range, but that is still very high. We need to get well below 100 before we can even start thinking about any kind of change in recommendations in the community. But I would say that to our community in general, in Olmsted County, the cities, the organizations, as we see the cases come down, to stay very vigilant about doing the things you can do to prevent transmission, wearing a mask, avoiding large crowds, spacing, being smart about events that will occur through the holiday season with good social distancing, and certainly building making sure there's good ventilation movement, or even HEPA filters we've seen where that can have an impact. So getting the message out, we did issue a news release yesterday. I believe Denise Daniels, our other associate director, was interviewed at least once, maybe more, to try to get the information out that during the holiday season, we want it to be a safe, enjoyable opportunity for all family and friends to gather, and you can do that safely. So I just want to wrap up our update with that and see if you have any final questions.
Madam Chair, changing the subject slightly, I was, because of the role I play in the State Community Health Advisory Council, I was invited to a briefing last Thursday, which I'm sure you have your own direct briefings with the Department of Health. And this was mostly healthcare systems and skilled care and hospitals. I'm trying to think, it was like really a broad range of stakeholders. And I think what was most telling is the exhaustion that all of the health systems are reporting, and the staffing issues that they're having, and the challenges that they're facing as this goes on and on and on, with workforce, with capacity, the worry about, you know, our ICUs being at 98% last week. And I was just reminded of how a year or so ago we all had hearts in our windows thanking our healthcare system providers for being on duty, and those have all disappeared, and yet the pandemic keeps going. The exhaustion is real, and the long-term impact on our healthcare system is yet to be determined, because some people are leaving the field. Last week, some of us were at the Association of Minnesota Counties annual meeting, and workforce issues are top of the line for our being able to deliver the kinds of services we're required to provide. And yet we're seeing a lot of people just reach their personal capacity and leave. So I think we're, you know, I'm really proud of Olmsted County, and to your questions, Commissioner Brown, there are just places in the state where there's just not a lot of support for immunizations, and we know that most of the people hospitalized weren't immunized. And so it's a kind of an interesting conundrum that we have a lot of evidence that vaccination works, but we have a lot of belief that that should be entirely my own personal choice and not some responsibility to a broader community. And we're just in this very strange place. When you look at some of the counties that were on our list where they're below 50% of their populations choosing to be immunized, it is a personal choice, but it is a choice that affects their lives and the lives of people around them and our whole system, because the choice of not being immunized and becoming ill is stressing our entire healthcare delivery system. So it's a sobering.
It is. Thank you.
Thank you.
Travis, you wanted to say something to us?
Apparently.
Chair Podolsky, Commissioners, Travis Grancy, Deputy County Administrator. I just wanted to follow up, and thanks to Megan and Mike for being here today, and we'll continue to share this information. You know, the last slide that was up there in regards to those vaccination clinics too, there's one point that I want to make. As you guys know, right, I've been learning a lot about public health. I've been learning a lot in a lot of areas. One thing that I just think is really important for everybody to acknowledge and just understand a little bit too is that going way back, right, this whole pandemic response has been a real partnership, right, with Olmsted County Public Health and Mayo Clinic and Olmsted Medical Center and others, right? And way back in the beginning then, a decision was made by everybody that, you know what we really need to do, we really need to ramp up testing, and let's set this thing up at Graham Park, right? And so we had this great process set up at Graham Park. Those conversations and those discussions have continued throughout this pandemic, right? And now we get to the point where our primary focus is on vaccination clinics, right? Because the infrastructure is now there to handle all the testing, right? The clinics got that, and the other pharmacies, and all right, so we've got, now it's all about vaccines. So the clinics that we've done here just over the course of the last month, which is really representative of through this whole time, this is a joint decision about, like, we're gonna take these, right? We've got these, and Mayo and OMC will say, yep, and we've got these. So there's a real intentional conversation about who's best equipped to do a particular vaccination clinic. And in the case now of the 5 to 11-year-olds, right, one of the things that we're seeing is that pediatric care, and I know Mike alluded to this too, right, that getting a shot from a pediatric nurse is a lot different than somebody that's used to sticking an arm in a 50 or 60 or 70-year-old person, right? So it's different. And those conversations happen with all of those community partners, like, yeah, okay, we're going to focus on this area, and you guys focus on this area. And so it's really strategic, and I just wanted to draw your attention to that this isn't, there's just a lot of intentionality that goes into where those particular people are going to get their shots. And I think that's something maybe that our community doesn't know enough about. Like, well, why isn't Olmsted County Public Health doing shots on this population? Well, because we had that conversation with all of our community partners, and we've decided that this is the best place for them to get their shots. So it's just it's an evolution. It's something that these folks are super intentional about, and we just want to make sure that everybody gets what they need, where they need it. So I just really wanted to, I guess, draw that point home and make sure you guys really understood how intentional those decisions were.
So public health is still leading and is still just as intentional and specific as we have ever been since the stuff hit the fan early last year.
Absolutely. Absolutely. They are still leading, and they are still doing a great job coordinating this response on behalf of this community. It's been fascinating. And the results, as you guys know, in Olmsted County bear that out and show that. So thank you.
Thank you. And now we will discuss Commissioner Flynn's concerns about Chester Woods.
Well, Stephanie, I think it's, over the years, we've limited the access, we've fenced, we wanted controlled area. I believe if we open it up, we won't have that oversight like we do now with security, with activities that could happen if we open it up on that.
Do we know, I know we stopped having entry fees during COVID.
Yes.
Do we know if there were any changes in how the park was used or misused at all during that time?
We have a volunteer.
Good morning, Commissioners. Kate Beniak, Physical Development. In the absence of our Director of Parks, Ms. Carlin, I am probably dangerous enough and hopefully can answer your questions. But as you mentioned, Commissioner Podolsky, we did take off the park entrance fees for 2021, actually in more of a response to COVID than anything, to encourage outdoor recreation, accessibility, etc. Carlin has conveyed the message, that we received really positive feedback from those efforts. Park usage increased. We got a lot of good reactions to not having that fee. It also freed up our staff that typically would have to sit at the front gate and man that effort. So that allows our staff to work elsewhere in the park, whether it's maintaining trails, cleaning up from a flood project, managing vegetation, helping campers, etc. So that's a real positive for our staff. So we continue to advocate for removing those park fees. It stays consistent with our other parks that we don't have fees at, and again encourages that activity outdoors, mental health, all those kind of things. So.
Well, go ahead, Sheila. Sorry.
Commissioner, go ahead, Al.
I don't disagree with the K, but when society gets back to, hopefully, to a normal pattern, we have had other problems at other activities when they're free, especially last year. Grant Park, the fair, the pools. I don't want to see that to happen. Sometimes when you have such easy access, it turns out to be a focal point or rendezvous point for people that don't have good intentions. That's my main concern. If we let that oversight disappear.
So, Madam Chair and Commissioner, I have actually not been to Chester Woods in the last year and a half, but I, in the past, would go to Chester Woods to ski or hike or whatever, and I almost never found anyone at the front gate. And that's not a criticism. I don't think it's the best use of staff time, but to your point is, we don't staff it 24/7. There isn't a gate that I recall that goes down when the park's closed. And so we really have access anytime. There's a lot of access, whether or not we're charging a fee. So I think for the park staff's experience of having increased use, not making that be making the fee be a barrier, there's some overall good to that. I would acknowledge that there's probably some risk, but there's risk in every one of our parks.
Right.
And I don't know why this one would be a higher risk. So I've been supporting the staff recommendation.
Well, that's fine. I just bringing up this point because I don't want to start to see problems that basically the gatekeeper kind of watches out who's coming and who's going. That's really what they do. You know, it's a nominal fee. There's great things down there. Again, I don't want to see this turn out to be a hangout or just a place to rendezvous with different crowds. And even though it's a nominal fee, I think that prevents that. So I just don't think we should. If the others want it, fine, but I don't think we should.
Yeah, to not echo, I mean, I go back and forth on this, but I think that I would certainly leave open to monitor the activity, see if anything changes, as Commissioner Flynn brings up, and believe that we can always reinstitute if necessary, if we see a problem, significant problem during those times or hours. So I'm not against this, but I'm certainly willing to look at it and continue to monitor and watch what happens.
Commissioner Flynn, would you be open to continuing to not charge a fee, but have a report from the park staff in 6 months?
No, I just don't want to start that non-fee on this one. Even though it's the only park, but we have many other things down there that we have the beach, we have camp, the camping you got to pay. But the beach is popular. I know that. There's fishing. What is the fee for the park? I have no idea. $5.
A daily is
It's an annual you can buy.
Yeah.
It's $5. Again, I just picture it as a good oversight position.
I'll make a motion that we leave it free for now and look at it again in 6 months.
I'll second it.
Well, 6 months. We're in December. We really wouldn't get to be June 1st, the camping season. I don't know what.
I just made that. I mean, I kind of think I know where this is going, so whatever.
Fine. Go ahead.
Okay.
Questions or comments on that? All right.
Madam
Oh,
Chair.
yes?
I just, before we vote, I just want to let people know that the park board itself approved this. They had a discussion, they debated, they felt that they could use their personnel better. They were very happy with the fact that the Olmsted County people are using the park more since the fee went off. Their rentals are up. The camping is up, and none of those fees are changed. So we're still collecting those fees. And the park staff itself is always out and about and observing what's going on. So the park board itself really recommended this, and it came through them to the Public Works Committee, Physical Development Committee. So they do support this.
So it's been moved and seconded that we continue to not charge a fee, but get an interim report, maybe in 6 months or 7 months as summer starts. So, all those in favor, say aye.
Aye.
Any opposed?
Opposed.
Okay, motion carries.
Thank you,
Thank you.
Commissioners.
All right, we are now going to recess in conference room number 4 for, what did I say?
Outside for recess, or, different recess?
Having fun.
County staff to execute all necessary documents to ensure county participation in the multi-state settlements relating to opioid distributors and manufacturers, and in the Minnesota Opioids State Subdivision Memorandum of Agreement, and declaring support for an amendment to Minnesota Statute Section 256.043, Subdivision 3D.
Move to approve.
Second.
It's been moved and seconded. Is there any discussion? Questions? All those in favor say aye.
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 All those opposed? Motion carries.
Move your microphone up.
So, let me find my agenda here again. And we'll move on to board and committee reports. We can start with Commissioner Beer.
Not much report. I'd just like to congratulate you on your, even though you don't, sometimes we've got to help you with the mechanics of running a meeting. You did a great job, and I mean it. Well, I mean, not that part, but you did a good job being chair, and I'd like to publicly congratulate you and thank you.
Thank you.
That's
Thank
so
you,
true.
Thank you.
True. I'm glad you have a sense of humor.
Well, dealing with you, Brown,
Well,
who would?
I have a sense of retribution too. Okay, do you have any reports, Commissioner
Yeah,
Brown?
a couple things worth mentioning. We had a MICA board meeting, and of course, a great deal of the conversation, besides setting legislative platform language in the various categories, there was a lot of discussion relative to this new surplus and the money that is coming along, and no real clear direction at this point in time, and it's early, right? But there was a great deal of discussion about what, don't spend it on brand new programs, don't implement programs, you pay as you go, what's going to happen with bonding bill, and on. So it was a very interesting discussion relative to that point. Then other meetings that aren't worth a great deal of mention. So that's the highlight.
Thank you. Commissioner Tyne?
I have no report.
Commissioner Flynn?
I just want to follow up with Jim. Thank you, Stephanie, and staff for the year, and the citizens of the county. Obviously, this COVID's getting old, making us older. And it's been 2 years of unknowns, and every day is a new day, unfortunately, with this. So I guess I just want to say, let's keep working along. Go from there.
Encouraging.
Yeah. Thank you.
Commissioner Cascaden?
Well, I was just going to report that, a couple of us spent several days last week with the Association of Minnesota Counties. And I was very proud of the presentation our county staff did on resilience during the time of COVID. We did a training for AMC. We were, I think, pretty well represented in a number of panel discussions up there. And so our ability to lead in things like the immunization and innovation in delivery of services I'm always proud. And so I think we're going to have a very interesting session ahead of us because as Jennifer Berkman said, when there's more money than less money, things get actually harder to deal with in the legislature. So I'm pleased that we are positioned as well as we are as a county, and congruent with MICA and AMC, and have good staff to work on these issues. And so it's just been an amazing year, and I'm sure you're glad as chair to see it come to an end. But I look forward to the new year with everyone as well. So.
Thank you very much. I also attended the Association of Minnesota Counties, and I'm happy to report that the legislative proposals that came through the AMC group really align well with the priorities that Olmsted County has. And so they'll be helping us with many of our priorities, talking to the legislature about that. While I was there, I also was able to talk to the Solid Waste Administration Group, which John Helmers is the executive director of that. And they are very supportive of our waste to energy facility, and will do what they can do to make sure that our status remains the same. And they understand that in the future, that there's going to be a lot more focus on landfills, and something else has to be done to avoid the toxicity that comes with landfills. And I presented to them that our bonding proposal for our MRF, which they were very supportive of, and if we are successful in getting our MRF, they would like to come down and look at our MRF, and hopefully use it as a model for other places. And I explained to them that that's only the first step, that following that, hopefully, if we have funds and we have the ability, that we may have a digester in the future of some place, and they're very interested in that as well, and to see how that works. In addition to that, then I attended the SEMREX meeting, Southeast Minnesota Recycler Exchange, which is 9 or 10 counties in Southeast Minnesota. And I was able to convince them, with the help of other commissioners on that the SEMREX also needs to have legislative proposals to reduce solid waste and to increase the recyclables. And that was successful at SEMREX, so I'll be working with the group to develop those legislative proposals with the help of Jennifer, and with the help of Tony out at the waste disposal plant. So I'm sure that with all those efforts, that hopefully that we will have a better handle on our solid waste. And also, lastly, a former commissioner, Commissioner Wilson, who preceded me, was honored as one of the past presidents of AMC. And I thought that that was very nice of AMC to honor not only him, but the other past presidents of AMC. And I'm sure he appreciated that as well. Thank you.
Well, thank you for the kind words, and I'm always proud wherever I go to say that I'm from Olmsted County. I just think we are a stellar run county, and this whole year has been made much easier because we have a stellar staff, and they predict things and plan ahead for things, and we get notified to think about stuff ahead of time, so we're not surprised. And I am proud of working with all of you, and I'm proud of this county. So, and now, this is the last time you'll have to indulge me with this, but you know that I've continued Commissioner Brown's
Stellar.
his what?
Still.
Stellar's
a word.
Our stellar Commissioner Brown's process.
Stellar idea.
Stellar idea of using presidential quotes, or using quotes. I did expand it a little bit. So today I have 2 quotes. And one is by a living president, and one is by Maya Angelou, which I think for me contains a lot of meaningful things about what this year has been like. So this is from Maya Angelou. I've learned that no matter what happens or how bad it seems today, life does go on. I've learned that you can tell a lot about a person by the way he or she handles these three things: a rainy day, lost luggage, and tangled Christmas tree lights.
Buckets, yeah.
I've learned that regardless of your relationship with your parents,
Good for that.
you'll miss them when they're gone from your life. I've learned that life sometimes gives you a second chance. I've learned that whenever I decide something with an open heart, I usually make the right decision. I've learned that even when I have pains, I don't have to be one. I've learned that I still have a lot to learn. I've learned that people will forget what you said. People will forget what you did. But people will never forget how you made them feel. And this is a quote from a wonderful president who is such an example for all of us, President Jimmy Carter. My faith demands that I do whatever I can, whenever I am. Excuse me, I'm going to start this over. My faith demands that I do whatever I can, wherever I am, whenever I can, for as long as I can, with whatever I have, to try to make a difference. Jimmy Carter. So thank you for indulging me with my quotes this year. It's been amazing year. I have a shirt at home that I bought last year, and it has, you know, how you rate things with 5 stars. And it says 2020, and only 1 star is lit up. It says very, very bad, would not recommend. I really thought this was over, and I think we need a, you know, if I found another shirt for this past year, it would be half a star. And we still persevere. We're still doing it, despite how tired and discouraged people are. Our staff. I'm so proud of them and so appreciative of how this keeps running, despite all these setbacks and all of the barriers that COVID has set in our way to keep us from doing what we normally do, which hasn't stopped at all. So this is an additional thing. And I guess I had to know by now. Do I need to make a motion to adjourn?
No.
No.
You can call for one.
I can. Why don't I do that?
Yeah, I
Whatever.
move to adjourn.
Second.
Any questions or comments? All those in favor say aye.
Aye.
Any opposed?
Hey.
Oh.
Oh.